Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Histamine. Hista means tissue. Amine is biological amine. So this histamine is formed by the decarboxylation of the amino acid L-histidine will result in histamine. So this histamine is again metabolized to methylhistamine. This histamine plays an important role in allergic reactions. In all the allergic reactions and in anti-inflammatory reactions, the histamine plays an important role. Then it is important in gastric secretions also. Gastric acid secretion, it is a neurotransmitter and neuromodulator. It plays an important role in immune function and also in the chemotaxis of WBC cells. So there are four receptors of histamine receptors. We have H1, H2, H3 and H4. First H1. H1 is present on smooth muscles and it is also present on the endothelium of the blood vessels. It is present on the endothelium of the blood vessels and it is present in the brain. This H1 receptor acts on GQ type of G protein receptors which increases the IP3-DAG pathway. The antagonist of H1 receptor is cetirizine and promethazine are the antagonists of H1 receptor. Then the uses of H1 receptor are they are responsible for sedation, they cause anti-allergic, they are anti-allergic, anti-emetic, anticholinergic, they have anti-Parkinsonism symptoms. They can be used as they have local anesthetic action. They are even anti-adrenergic action is present and they are anti-serotonergic action and anti-vertigo action is present with H1. Then H2. H2 is present in gastric mucosa and it is present in the cardiac muscle, mast cells and it is also present in the brain. So this H2 is a GS type of G protein coupled receptors which increases the cyclic AMP. H2 is blocked by the drugs like cimetidine and also ranitidine will block the H2 receptor. This H2 receptor will prevent gastric acid secretion. It will prevent gastric acid secretion. Then H3. H3 receptor is present in presynaptic autoreceptors and also it is present in heteroreceptors. This H3 is present in the brain and also in the myenteric plexus and it is also present in the neurons. This H3 will cause GI type. It acts by GI type and decreases the cyclic AMP. This H3 is used in conditions like asthma mainly and also chronic inflammatory conditions. Then we have H4. H4 is important. It is present in eosinophils, neutrophils and CD4 T cells. These H4 are acts on GI type and decreases cyclic AMP. The antagonist or the drug which inhibits H4 is thioperamide inhibits the H4 and this H4 receptor antagonist is useful in pruritus or asthma or it is useful in allergic rhinitis and in pain conditions this H4 antagonist is useful. Similarly here sedation, anti-allergic, anti-emetic, anticholinergic, anti-Parkinsonism action, anti-adrenergic, anti-serotonergic actions are caused by this H1 antagonists. Similarly the H2 antagonists like cimetidine, ranitidine will prevent the gastric acid secretion, whereas H3 antagonists will be used in asthma, whereas H4 antagonists will be used in pruritus, asthma and allergic rhinitis. We have a drug called as tiprolisant. Tiprolisant is actually an inverse agonist of M3 receptor. Tiprolisant is an inverse agonist of M3 receptor.
Thank you and thank you for watching.